Yeah, and I think it's an interesting, I'm interested in your thoughts on this, but there's almost, we know in mental health, there's been this nihilism around,
Yeah,
this idea that, well, you know, we could write that team care arrangement, but is it actually going to do anything?
yeah,
And this is where I think that's what I'm really interested in is, well, why are we failing to create something that does work? Why are we failing to create a referral system that actually supports that person to participate? Um, so that to me, I think that you're right. It applies across diabetes, across the range of NCDs. But I think there's a lot of work to do in terms of, yes, we have this referral system, but to actually making it useful, making it appropriate, and making it safe for the people that we're trying to reach.
yeah. And I think they've made some changes too with the mental health plan. I remember during COVID, they increased that to 20 visits per calendar year, I think it was, and then now that's dropped back to 10. I think even less now. But there's a new requirement where you actually have to follow up with your counselor or psychologist in order to get access to the further sessions. So I think there is that also that element of the government, especially after the COVID period, trying to really tighten up in terms of their healthcare expenditure. And I was talking at a recent um, seminar with regards to some people living with type 2 diabetes. And around 9 or 10 years ago, they used to Medicare used to subsidize dental care for people with type 2 diabetes. But because the GPs weren't writing these referrals and no one was accessing these rebates or these subsidies, they got rid of it. And so I think there is a potential push to, if no one's using, like for instance, the type 2 diabetes group
Yeah.
allied health management plan, just to scrap that. So I wonder whether what you're saying is correct in that, GPs maybe see it as something it's there, but it's not of, immediate or innate requirement in order to change their mental health status. And so they're not referring their clients to see a psychologist or a counselor, and therefore, the government's tightening up on healthcare expenditure despite the problem getting worse.
So, yeah, I really resonate with what you're saying because a big focus of my work at the moment is around like the workforces. So thinking about the mental health workforce and then thinking about the physical health or physical activity workforce and nutrition
Yeah,
and thinking about what do we need to bring those two together. So we're doing a lot of work training, the physical health, so training exercise physiologists, physiotherapists, dietitians in mental health skills, and then thinking about, well, what do we need to do to train the mental health workforce in physical health, physical activity and nutrition skills, and then how do you build referral pathways between them and bring them together? And one of the really interesting things thinking about those referral schemes that you mentioned is that we know there is a huge shortage of mental health professionals. So the waiting list of people waiting for counselling or psychologists is enormous. Um, we do have a physical health workforce that is essentially ready to go, that could be mobilized to be providing nutrition, exercise support to people living with poor mental health. Imagine if we had a system whereby someone, gets a referral to a psychologist or a counselor during that waiting period. If they're waiting 3 months to access that person, why can't they get some support with their physical
yeah,
health in the meantime?
yeah,
Now, at worst case scenario, you improve physical health outcomes. Best case scenario, and again, this is, if we look at the treatment guidelines for depression, it's very clear that for some cases, so not for some cases, for all cases, but lifestyle change should be recommended as the first line strategy. But acknowledging that for some cases, so for mild to moderate cases, lifestyle change may be enough. So I just think that we've got this huge opportunity to think about relieving a burden on the healthcare system, improving physical health outcomes, by thinking a bit out of the box about what is a mental health practitioner or who contributes to providing mental health care.